Awesome. Thank you, Dr. Chow. And it's great to be back on in rounds. I don't get to attend as much as I would like with our procedures being on Thursday, but I'm really happy to be here. And then through 2 weeks in a row, we'll be doing our first talk today on the introduction to 3D Echo Part 1. And today we'll be talking about image acquisition and processing. And then next week, we'll talk about how to examine each valve and multiplanar reconstruction, try to take things to a different level. So these are the objectives for today's talk, are to understand how to go from 2D to 3D. We're going to spend some time talking about biplane imaging, and then we're going to talk about image acquisition and then image processing for 3D echocardiography. And just as a bit of a disclaimer, I'm mainly going to be talking about one platform today, the Philips platform, and that's mainly just because that's what I'm most familiar with and what I most use for 3D echo. But a lot of what I'll be talking about also applies to other platforms like GE. They just have kind of different names, but the processes are similar. So this is a helpful resource. It's the EAE ASC recommendations for 3D echocardiography if you want a good place to start. And so a bit of trivia. Does anyone know who this is, either online or in the room? And if you don't, that's totally okay, because this is one of the tougher trivia. So this is Dr. Olaf von Ram. He's the it's okay. He's the Thomas Lord Professor of Engineering at Duke University, and he's actually credited with the development of real-time 3D echocardiography in the early 1990s, and he holds the first patent for 3D echocardiography. And as a Canadian connection, he actually obtained his bachelor's and master's from the University of Toronto. So in terms of the history of 3D echocardiography, as we know, echo started with A-mode 1D imaging, single crystal, and then with the development of the phased array probe, this allowed for the development of 2D echocardiography. And then with the matrix array probes, arranging the crystals in this matrix pattern here, we now have the capability to do 3D imaging with echocardiography. And it's really through advances in hardware, software, microelectronic techniques, and computing. Really, all of these have developed over time to allow for the creation of 3D images with echo. You do need these special matrix array probes to produce 3D images, and as time goes along, the image quality is getting better and better. So this is just some examples of a 2D image, a peristernal long axis here. And then with 3D, you're able to expand on that 2D sector to provide some depth. And there's different types of 3D mode that we'll be talking about here that can produce different images. So the main things we'll be talking about today are image acquisition and then imaging process and display. We're going to be talking about the mitral valve a lot. I think it's a valve that's easier to understand. There's a lot of interesting pathology associated with it. So, but just for today, we're going to be seeing a lot of the mitral valve. So just some orientation. The mitral valve has two leaflets, has this anterior and posterior leaflet, and then each of the leaflets is divided into three scallops typically. So the most lateral scallop are the ones. The scallops in the middle are the twos, and then the scallops on the medial aspect are the threes. And so if we take our 3D image, we have our anterior leaflet and our posterior leaflet here, and then each of them has three of these scallops that we note here. We typically, when we orient the 3D image for the mitral valve, the aorta is at 12 o'clock up here. Then there's also these commissures. We call this the lateral commissure associated with the ones on the lateral aspect. And if we saw the appendage here, the appendage will be on this side. And then on the right of the image is the medial commissure where the threes are. And this is sort of where the septum is. So it's just some basic orientation for the anatomy of the mitral valve. We'll be seeing a lot of it today. So just a refresher on biplane imaging. Once you have a 3D probe, you're able to do some biplane imaging. And so this is an example of a bicommissural view for a transesophageal echocardiogram. So again, just orienting everyone. I know not everyone does TE, but this is an example of what we call the bicommissural view. It's usually taken between, around 60 degrees or so. In this patient, it was closer to 75. And this sort of looks like a two-chamber view in the transthoracic echocardiogram. We've cut off some of the ventricle here, but you see the two papillary muscles. And what you see is the medial commissure denoted by the M, and then the lateral commissure denoted by the L. And if we took a cartoon of the mitral valve, this black line would be where the bicom view is cutting. So it cuts along the commissure between the anterior and the posterior leaflet right in the middle, sort of here, and we were able to see both commissures and the coaptation points. And then when you do biplane imaging, you cut along a plane and you produce an orthogonal image. So this original image was taken at 75 degrees, the orthogonal image 90 degrees is at 165. And what this does is this produces a long axis image of the mitral valve here. And we see the posterior leaflet denoted by P and then the anterior leaflet denoted by A. And it's easy to remember this is the anterior leaflet because it's closer to the aorta. And this red line would be where this biplane is cutting from. So this is how we do X-plane imaging. And what I like to think about when I'm doing X-plane imaging is I always want to start someplace where I know where I am. So, and that's where the bicom view is very helpful, because if you produce a good bicom view and you cut right in the middle, you're going to be at the twos. You're going to be in the middle of the mitral valve. If you cut more medial, you bring this cursor more medial, you're going to be in the medial aspect of the valve, and you're going to be more in the medial commissure. You're going to be in the threes. And if you go more lateral, you're going to be in the ones. So I always start when I'm doing my biplane imaging in an area where I know where I am, and then in the orthogonal image I can see what else I want to see. The other time I use biplane is that if I don't know what a structure is and I just want to put an X-plane on it and just try to understand it more, that can be very helpful as well. So this is an example of a biplane imaging with color applied, and we can see some regurgitation coming through the center of the valve. But there are obviously other jets of regurgitation that we're not seeing here on the X-plane imaging. And so this brings us to our concept of mitral valve mapping. And so this is a way of understanding the anatomy of the valve by examining it in a purposeful manner. And so what I've shown here is the image on the most left. We have our bicommissural view. We have the cursor cutting through the medial aspect of the valve, and then that produces an orthogonal image where we see the long axis of the valve, and we see that there's this prolapsed and flail segment of the posterior leaflet here, and this would be at the threes. And then if we bring the cursor to the middle of the valve, this brings us to the twos, and we see the coaptation looks okay here, maybe borderline a little bit of prolapse here at this posterior leaflet, but it looks okay. And then we go more lateral here, so the cursor is now in the lateral aspect of the bicommissural view. This coaptation looks okay. So the pathology mainly seems to be medial here. And you got a sense of that from the bicom, but you can really prove it by using this biplane imaging, by going in an organized fashion. Again, starting where you know where you are, and then learning more about the pathology through the X-plane imaging. And so, when we are doing mapping and we're looking at images in 2D, we're trying to build this picture in our mind of what does the valve look like. And that's one of the handy parts of where 3D is. 3D, right away, just by producing a high quality 3D image, you can see this flail and prolapse segment of the posterior leaflet. It's obvious what the problem is here, right? And so, while the resolution and the quality with 3D imaging is not as good as 2D imaging, it produces a big picture image to understand pathology, and that's where I think its use really comes in. And then likewise, you can map with color. We see this big medial jet here. And when we put the X-plane over the medial commissure, you see this eccentric, severely anteriorly directed jet of mitral regurgitation. But then when we interrogate the rest of the commissures, the twos and the ones, there's not much color that comes through here. The main problem is really medial, where this flail is. And then in 3D as well, we can see the color comes through the medial commissure here, where that area of flail is. And then just a note is that, you don't have to just take 3 images, one for each of the, one for the ones, one for the twos, one for the threes. You can really spend some time and move your X-plane slightly to the left or to the right to, really get a good sense of what the pathology here is. And that's what we're showing with this example. And you don't have to do biplane imaging with just with transesophageal echo. You can certainly do it with transthoracic as well. So these are some images from our echo lab here. This is a personal short axis of the left ventricle, and we see that by putting the cursor through the mitral valve right in the middle, we appreciate that there's this prolapsed segment of the anterior leaflet, and that you can see on the X-plane imaging. And we know that this is in the twos because it's right in the middle of the valve. And then when we apply color to this area, we see this eccentric posteriorly directed jet, which fits with that pathology here. So, and then the sonographer actually goes a little bit medial here. So we see the, interrogating the medial, and we're looking at the ones here. There's maybe a little bit of prolapse here at the ones. or sorry, at the 3, sorry, my mistake. And then as they go lateral, they'd be looking at the 1. So this would be, showing the A1 and then the P1. And, the image is a little bit dark here, but, again, just looking to see if we see any gross pathology here. So that's an example of how you can map the mitral valve in transthoracic. And then, similarly to using the BICOM view in transesophageal, you can use the 2-chamber view on transthoracic to map the valve as well. So, if we go to the left of this 2-chamber view here, we put the X-plane image, this is going to produce your 3s. This is going to be looking at the medial aspect of the mitral valve. If we put the cursor in the middle, this is going to be looking at the central aspect of the valve, and you see that there's a problem here. This posterior leaflet is prolapsing here at the 2s. And then if we go more lateral, coaptation, it's a little bit kind of foreshortened here, but we don't see major pathology here. The main problem seems to be at the 2s. And when you're examining the area with your X-plane imaging, you can apply color as well. And so in addition to this, prolapsed posterior segment we see here, we see that this jet is eccentric and anteriorly directed, and that fits with the pathology. So this is how you can map with transthoracic if you so choose. What about doing 3D with transthoracic? Well, this can be a bit more challenging. We have a nice quality, transthoracic image here of the mitral valve, and we see this flail posterior segment here with this eccentric anteriorly directed jet. So you can use 3D. You can apply your boxes and create a 3D image of the mitral valve. It'll produce something like this. It'll give you this pyramid. You have to do some processing stuff that we're going to talk about, and then that processing will then produce this 3D image. And so this is the 3D image on transthoracic, and this is the same patient with transesophageal. So you can appreciate that there's something kind of prolapsing or flailing in the middle of the valve, but the quality is not great. And over time, as the technology gets better, it should hopefully get better. But you really do need good quality 2D images in order to produce 3D, which is one of the things that makes it so challenging with transthoracic. Compared to transesophageal, you're much closer to the mitral valve. The probes are of a different quality, and you're able to produce these high quality 3D images here. So a lot of what we're going to be showing today is transesophageal, but just for those who are interested, you can apply these concepts to transthoracic as well. One of the first principles is that you need good quality 2D images in order to produce 3D images. So this is a transesophageal echo. The contact is not good. You can see on the 2D images, it's kind of dark. We don't see the valve very well. It cuts in and out. It's choppy. So if you take this and you produce a 3D image, this is what you're going to get. It's not helpful at all. This is the same patient. If you just improve your image, improve your probe contact, get a better looking 2D image, the 3D image improves significantly. You can see the difference compared to the previous. This is another example where, probe contact, it's not too bad, but, it's again kind of a fuzzy image. And so if you have a fuzzy image, it's going to produce a fuzzy 3D. But if you take the time, use your knobs, try to improve the contact with the esophagus, the 3D quality does go up. Another principle to understand with 3D is that you can't solve shadows with 3D. So just because you're taking a 3D image doesn't mean the shadows are going to go away. And that's because your 3D image is built from 2D images, right? If you want to get around shadows, you have to change your probe position or probe contact. This is an example of a patient who has a thick septum, and then there's some MAC here, and this creates shadows along the septum and the right ventricle. And then so when you take a 3D image of this, you see the shadows are there. They don't go away. So that's an important concept to understand. This is another example of taking 3D of the tricuspid valve. So this is looking at the tricuspid valve here with biplane imaging. And you can see here that there's some shadowing from the septum. We don't see the tricuspid leaflets very well, some shadowing from the aorta here. And when we try to produce a 3D image of this tricuspid valve, boy, that aortic valve looks good, but the tricuspid valve, you don't see much here. But in the same patient, if you try to improve your position, so this was a lower esophageal window going deeper into the esophagus, producing this tricuspid valve. We're looking through the right atrium instead of looking through the left atrium. The leaflets looked better on the 2D image. The image looks kind of funny. It's not what we're used to looking at. But when you apply this to 3D, that valve looks much better. So shadows, you need to optimize your probe position. You can't just get around that by using 3D. So in terms of the image acquisition modes, there's a few different modes that we can use to acquire 3D image, and so we'll go over that. The simplest mode is this 3D narrow angle mode. And so this is just when you press the 3D knob, it'll just produce a 3D image of whatever you're looking at with the image that you have on your screen. It's simple. It provides a bit of depth, usually like 30 degrees of depth or so. Versus full volume, which takes a much bigger volume, a much bigger pyramid, you get more data within that. But as a result, because you have more data to process, the frame rate will be lower. So that's another important principle to understand, is that the smaller your sector is for the 3D acquisition, the higher the frame rate and the higher the resolution you're going to get. So what does 3D look like? So this is an example of 3D narrow angle. You just press the 3D knob down on the console. And as I said, again, it's the simplest method to acquire. It produces a 3D image right away, but it's the most limited method as it only makes a narrow angle of whatever you're displaying. And so this is an example of a mid-esophageal view, kind of like a 4-chamber view here. And if you press the 3D knob down, it produces this 3D image of whatever you're seeing here in 2D. It provides a bit more depth, so you can see that there's where my cursor is. There's this flail segment of the mitral valve that we weren't seeing on the 2D image here, so it provides a little bit of depth here. But I find this mode a bit limited, and the reason is if you take this 3D pyramid and you turn it on its side, this is all the depth you get from just pressing that 3D knob. Again, it's quick, but it's rather simple, and then as a result of its simplicity, it limits you in terms of what you can do. Another mode to be aware of is this mode called full volume. And so when you press this, and I'll show you where the button is on the touchscreen in a second, when you press this, it will create a much larger pyramid that will contain more structures. It's called full volume because, again, the pyramid is much longer. It's basically everything that you see. And so the advantage of this is that it gives you a large data set to then process structures. The disadvantage of this is that you'll end up having a lower frame rate because the sector is so big. And I'll show you how to get around that. So this is an example of the pyramid that you would get with a full volume. You'll notice that compared to the 3D one that I just showed you, it looks kind of similar when you look at it from the front and on the side. But just to be aware that it comes cropped. So you see this green square here, this is cropping that 3D pyramid about halfway through. So you see what looks similar in terms of the left ventricle, the right ventricle, the mitral valve, a little bit of that flail segment. But on the side view, you can see that it's cropped here. And when you bring that crop plane back using the plane adjust knob, you'll go from the image on the left to the image on the right. So now you're able to see more structures. You're able to by bringing that cropping plane in. The trouble is that you end up producing this blob-like pyramid that has a ton of data within it that you then have to go through and dissect to actually find the structures that you're interested in. So that's one of the things with full volume mode is it's good for having a large data set, but then you need to do a lot of processing to understand it. The anesthesiologists really tend to like this mode because they're able to acquire a big data set right away. And then while the patient is being operated on and they have some time, they're able to then go through and dissect out all of the structures here. And so you can use various cropping modes that we'll talk about to find the structure of interest. Now, as I said, one of the problems with this is that, because it's a larger sector, the frame rate tends to be lower. So with a full volume, we had more data. This went down to 13 hertz. When we did the 3D zoom, it was more like 20 hertz or so. So you lose frames by having more data within it. One of the ways around that is something called multibeat acquisition. And so the way this works is by acquiring multiple small pyramids and then stitching them together. And I'll show you some examples of that. But all this is to say is that by doing that, you're able to increase your frame rate. So now the frame rate of this 3D image went up to 46 hertz by stitching together 4 beats. And it did this by stitching together 4 smaller pyramids. The image overall looks better, but as a result, you can get stitching artifacts. So that's just something to be aware of, and I'll show you an example of that. What's cool about this is once you have a big, data set that has a lot of information on it, you can do a lot of cropping to understand the anatomy. So this is an example showing the mitral valve, the aortic valve, and then the tricuspid valve. You'll notice that there's kind of these lines over here. And so this is an example of that stitch artifact that I was telling you about, where it's stitching together these pyramids. And then you can crop the data set further. And so we can examine that mitral valve and we can see that flail medial posterior leaflet here. But again, there are these lines kind of here from the stitching. That's not entirely helpful. And then, what we'll talk about in the next session is something called full volume and multiplanar reconstruction. And so what you can do with this then is you can actually dissect the 3D image and then reproduce the 2D images that produced it. And so you can get all sorts of like wacky stuff where you produce, you can assess wall motion using this, or if we want to see that posterior leaflet in 2D, we can then show that in 2D on this image here, and I'll show you how to do that in the next session. So my bread and butter is the 3D zoom. This is what we use most commonly because we're mainly focused on one structure at a time, mainly a valve. And so the 3D zoom button is here. And so this is the basic 3D zoom workflow. You want to have a good quality image to start with, good quality 2D, so spend some time optimizing that. You then press your 3D zoom button. It'll create these boxes, and you'll have to orient these boxes to capture the structure of interest. It'll then produce this pyramid, and then you'll then have to do things to bring down the gain to get rid of some of the smoke in the left atrium here. You're going to have to tilt the image so that you see the valve on fast, and then you're going to have to rotate Z to orient it in the proper position. And then at this point, you're ready to acquire the valve. So this is an example of the basic 3D workflow. When you press 3D zoom, the console will have these presets for mitral, aortic, left atrial appendage. I tend not to use these. I don't find these entirely helpful for myself, but you may find them, so it's worth experimenting with if you wish. These elevation, position, and width knobs on the bottom here, I bring your attention to these because these will be very important for adjusting the boxes to get the right box for what you need. So this is a video showing how you move the actual boxes. So there's this box position on the bottom here, and it's lit up. And then when you use the trackball, you're able to move that left box left to right, up and down. And you'll notice that when you move the left box up and down, or you increase the size of the box up and down, it will also change the position of the right box up and down. It'll change the depth of the right box up and down. So you're able to adjust the left-sided position and the size using the trackball and the buttons here. But how do we adjust the right side? Well, if you want to adjust the right box, that's when you have to use these elevation position and elevation width knobs. And so the elevation width will change the width of the box as shown on the image on the left. You can make it more narrow or more wide to highlight the structure that you're interested in. And then the elevation position will swing that right box to the left or to the right, again, depending on whatever you want to highlight. So through a combination of the trackball and these knobs, you're able to adjust these boxes to highlight the structure that you're interested in. That's very important. And the reason why that's important is that the sector size is going to affect the frame rate. So this is an example of a flail posterior leaflet here on the 2D image. And what I'll show you is that if you have a big sector on your 3D zoom, so this is an example of what the sector might look like, you get more structures in this 3D image, but the frame rate is choppy. And that's not just choppy because of zoom, that's choppy because the frame rate's 5 hertz, okay? So there's more data for it to process. What if you restart and make your boxes smaller, this is an example of what it would look like with the red boxes in the middle and the red boxes on the 2D image, you see less structures, which doesn't really matter because we're focused on the mitral valve here. You still see the mitral valve in full, but the frame rate's gone up to 9 hertz. And if you now make the boxes even smaller, so you restart your image and make the boxes even smaller, you've now gone up to 13 hertz. The image quality is significantly improved compared to the image on the right. So I do think it's important to understand how to make your boxes as appropriate sized as possible to optimize your image and optimize your frame rates. And then there's different acquisition modes. There's single beat modes, high volume rate, and multi-beat acquisition. So these can be found on the image quality. So on the touch screen here, there's this image quality button here, and it defaults as balanced. But what this does is this allows you to prioritize frame rates or resolution depending on whatever you're interested in. These can only be changed at the time of image acquisition. They can't be changed in post-processing. In general, I just leave it on balance, but I'm going to show you some examples of what these can do if you're interested. So when you press that button, it'll give you the option of balance, resolution, resolution plus, frame rate plus. And so this is an example of balance. And again, this is the default. This is a bioprosthetic mitral valve here without color and then with color here. And so this is now comparing it. If you change the acquisition to frame rate, what would that do? And so this increases your frame rate up to 38 hertz. Maybe some of the moving structures like the leaflets look a little bit better, but the image overall I find is like a little bit fuzzier. It's not a marked difference between the two. And then you get to this frame rate plus, which brings your frame rate up to 41 hertz compared to 29 hertz. And again, I don't notice a big difference. Again, I think the image on the right is a little bit fuzzier compared to the balanced image, which is why I don't tend to change this. What about resolution? Well, when you increase resolution, the valve and some of the sutures look more crisp here. You'll notice that we have more smoke in the atrium, so we'll have to adjust for that. But the frame rate's gone down, so some of the moving structures like the leaflets don't look perhaps as good as they did on the balanced image. And then resolution plus will bring your frame rate down even lower with a trade-off of having more resolution here. But again, the atrium looks very smoky. When I bring the gain down to get rid of that smoke in the atrium, I can't say that resolution plus actually made a big difference here, aside from decreasing my frame rate. So generally for me, I just leave it on balance. I don't mess around with this, but just to be aware, these options are here if you're interested in experimenting. Then we're going to talk about high volume rate. So this is found under the 3D optimize button here. You'll see it defaults at 1 beat. And when you press that, it gives you the option for 2 beat, 4 beat, 6 beat. We'll come back to that, or high VR1. And so this is an example of high volume rate. The balanced image on default is on the left, and then the HVR is on the right. You'll notice your frame rate has gone up significantly, but is the image better? I think it depends on whatever you're imaging. And the way this works is through this method called interpolation. So what this does is this measures the 3D data at multiple points. So it sort of measures like this checkerboard where it measures the 3D data at all these different black squares, and then it assumes what's in the white squares. And that's sort of why when I look at these images in HVR, I often find that they sure have a higher frame rate, and that makes sense because they're processing less data, but the image quality, it kind of has this checkerboard appearance, and I don't routinely do this, but just so you're aware that it is an option that's available. So this is an example comparing the same valve acquired in balanced versus in HVR, and you can see the frame rate's gone up, but this valve really has this like checkerboard kind of appearance. And again, the way this works is by measuring at some points and then assuming at points in between. And so that's sort of why it gives this sort of appearance here. The frame rate's gone up, but I'm not sure that's added a lot in the quality. When you're examining color in 3D, this can actually be useful because color is a higher velocity, so the frame rate is more useful there. But for 2D structures, I find it's not super helpful, but to be aware. Multibeat I do find useful if you can use it in the right patient. And so it's again found under this 3D optimized tab. So you press that and your options are 1 beat, which is what it starts off with. And then you can do multi-beat. And this is that stitching process that I was talking about before, where it's 2 beat, 4 beat, or 6 beat. So let's say we pick 4 beat here. And so it'll change this to 4 beats. And the way this will work is instead of acquiring your 3D image as one large pyramid acquired each beat, it will acquire 4 smaller pyramids and then stitch them together, where 1 beat is acquired with one pyramid is acquired with 1 beat, 1 beat is acquired with another beat, etc. And then it stitches them together so that each individual pyramid is smaller, so your frame rate and your resolution goes up. So this is an example of the same valve acquired in 1 beat, 2 beat, and then 4 beat. You can see in 1 beat, the valve already looks pretty good, 19 hertz, like it's a nice quality image. When we go to 2 beat, you go up to 35 hertz. So the frame rate goes up. The image looks a little bit better. You'll argue that the image in the middle has like a little bit of choppiness and stuttering kind of when it starts. You can get around that by taking kind of multiple images so that you can pick the best one, for example. And then when we go to 4 beat, the frame rate's gone up to 65 hertz, but there's a lot of this stitching. You can actually appreciate where the individual pyramids are. And so stitching can be exacerbated by patients who have an irregular heartbeat and atrial fibrillation. Multi-beat is often is not helpful unless they're slow and regular, or just by the patient breathing in their natural respiratory cycle. So in the cath lab, what we'll often do if we want a high quality data set and the patient's intubated and sedated is we'll often pause the lungs for a few seconds to acquire that image so that there's no movement, and then we have a good quality data set that we can then dissect, and then we let the patient breathe. This is sometimes you get lucky though. Like this is a patient that we did 6-beat acquisition on. The frame rate's 91 hertz. The imaging sector is huge, and the valve looks quite nice. So if you have the right patient that's in a regular heart rhythm and can perhaps do a breath hold, multibeat is really nice to improve your frame rate and then what you're able to do with that data set. And then reorienting and cropping the image is also important to be aware of. So, what we'll do for the mitral valve is you'll get this sort of pyramid to start with. We'll tilt the trackball up, and then we'll use this knob called rotate Z, which will rotate the valve along the Z axis, which is usually just like into the valve in terms of how it was acquired. And then we put the valve so it's smiling, and the aorta is at 12 o'clock is the usual orientation for the mitral valve. And so this is an example of, on the left image, using 3D rotate. So this is using a trackball to move the image around in 3D space. This is a patient who has severe MAC. And then if you use the rotate Z knob, what that will do is that will rotate the image along the Z axis. So through a combination of using the trackball 3D rotate and the rotate Z knob, you're able to orient your 3D image as you want. And so this is an example of rotate Z, showing kind of where the Z axis would be, looking into the valve here where the dot is. And as you rotate that knob clockwise or counterclockwise, you're able to orient the valve in really any position you like. There's various cropping modes that we'll talk about. The one I find the most helpful is the face crop. It's the simplest one to use. The button's right on the front of your screen. And what this will do is this will crop along the way you are facing the valve. So once you have the valve oriented in the way that you want, you just use this face crop knob and it will crop the image. So one of the things about this though is that it actually doesn't show you the cropping plane. So you have to kind of orient it, and then with faith, you turn down the knob, and then it will slowly start to crop the stuff away. So this is an example of it. Again, this plane does not show up when you crop, but when you turn on face crop and then you turn the adjust plane knob down, it's almost like you moved that line from up here to down here, and then you produce an image like this where some of the atrium is cut away, and you're able to see the valve in better detail. And so again, this is just a review of the basic 3D Zoom workflow. Again, optimize your 2D image, make your boxes as big as they need to be to contain the structure that you want to examine, but also make them as small as possible so that you can improve your frame rate. You're then going to produce a pyramid, and through a combination of trackball and rotate Z, you're going to orient your image in the orientation that you want, and then you're ready to go. For the remainder of the talk, we'll talk about post-processing. And so this is using aspects of the software to manipulate and analyze the 3D data set. While it's called post-processing, all of these things you can do live. And in fact, I encourage you to experiment with this live, but these points mentioned here, you can do after the image is acquired, once the patient is gone, for example. Some important things to know that you can't do in post-processing. So you can't change the acquisition type. So if you acquired it as a 1-beat, you can't then go back and acquire it as a multi-beat from the same data set. You have to acquire a new data set while the patient is still there. You can't change to frame rate plus. You can't change to HVR. All of those are at the time that the image is acquired. You can't add color to a non-color data set, though you can do the opposite. You can remove color from a color data set to see it as if there was no color there. But you obviously can't add color to that. You can't improve the frame rate. So even if you crop the image and make it smaller, all that does, that's a post-processing thing. That will not actually be like you have a smaller sector, and that will not improve the frame rates. And then you can't increase the sector size. I think that's obvious as well. You can't create what's not there. So that's why spending time to make sure you have a good 3D data set to start with is very important. So the first thing I'll talk about is these color palettes. And I personally never change these, but just there because it looks kind of cool. So there's this thing called Chroma Map in the top left corner. And when you pick that, it gives you these options for all these wild and wacky chroma maps. And so this is an example of kind of the different colors that you can produce to change your 3D images. The default is sepia. I never change it from sepia, but there's like all sorts of different colors there. And so just some people are very opinionated on the color palette that they use. So just to be aware that they're here. Maybe you're a thallium person, and that's how you want to show your 3D images. And then likewise, there's this 3D vision knob, and I show it just for awareness, but again, this is something that I never really touch. So what does this do? This changes the 3D image to have these different shades of brown. The default is this vision H. I never change this, but just to be aware that it's there. Then there's this true view in the middle. So this is kind of a neat feature. When you press this on the touch screen here, it will turn your touch screen sort of mirroring what your image looks like on the top screen of the console. And so what True View and Glass View do, True View makes the tissue look more, or makes the valve or structure look more tissue-like. It gives it a tissue-like appearance. And some people really like this. Or the Glass View is also shown here. It gives it a glass kind of appearance here. And you can apply color to these images as well, and you can take the images with color. I tend to just leave it on the default, but some people really like to show the true view as a tissue like, and that's awesome, 2D and 3D gain are worth talking about as well. This is another important part of actually being able to present your image properly. So this is an example of a patient that we did mitral transcatheter edge-to-edge repair. There are two devices in the middle of the valve at A2, P2. And what often ends up happening when you acquire a 3D image is that it starts kind of overgained. And so you see there's a lot of this smoke in the left atrium. And so before even starting to crop this image, I would just turn down the gain. And so that's what this image is showing here. We turn down the gain, and that smoke in the left atrium is brought down, and we're able to see our valve in better detail. And so you can turn down the gain in two ways, either with 2D gain or with 3D gain. This is in the middle is the baseline image that's showing a patient undergoing mitral transcatheter edge-to-edge repair. There's a device that is below the valve right now. And one of the ways we want to be able to see the orientation of this in the cath lab is we turn down the gain. And so it makes the leaflets more transparent, and then we're able to see the orientation of the device and say, do we need to clock it or do we need to counterclock it? That's one of the uses of this. And so when you turn the 2D gain down, focusing on the image in the middle and the image on the left, you'll notice that these images in 2D on the side also go down. So when you turn down 2D gain, you decrease the gain of your 2D images, and as a result, your 3D images. Now, when you turn down the 3D gain knob, it will keep the 2D image gain preserved, but it will only turn down the gain of the 3D image. And depending on what you're trying to display, that may be useful. Oftentimes in the cath lab, I'll decrease the 3D gain while keeping the 2D gain here so that the interventionalist can see how deep they are and the leaflets. As if you drop the 2D gain too much, you may make the leaflets harder to see on the 2D images. And so these are examples, and it's always trying to find a balance with your gain where you don't make these artificial holes. Like if you turn on the 2D gain too much, you'll create these holes in the valve that aren't necessarily there. But if you increase the gain, you'll start to have some smoke in the atrium. So it's a balance there, and that's true with both 2D gain and then with 3D gain as well. If you turn up the gain too much, you'll start to have a lot of smoke, and you won't actually be able to see the valve. So taking some time to optimize that, I think, is very important. And then we'll talk about cropping modes. There's various cropping modes to be aware of. The face crop we've already talked about. So again, it's my go-to because it's right on the front screen here. There's this face crop button. And so when you take that face crop, again, it crops whatever you're looking at. It crops on face. So again, it's like you have this theoretical cropping plane here, and then you bring you turn the plane adjust knob down. That brings that theoretical cropping plane down, and then that will produce a cleaner image. And I like this because oftentimes what I want to get rid of is whatever I'm facing. I just want to see the valve. I want to get rid of the stuff in the atrium that's blocking the valve, for example, or just making the image not look as good. And so you can just get rid of that right away with a face crop. That's why I like it. And so this is an example of turning that plane adjust knob down, starting on the left. There you can see there's some smoke and some parts of the aorta here that we don't want to see. That's making it harder to see this mitral valve. And by turning that plane adjust knob down, we're able to see the mitral valve in better detail. And there are other cropping modes, just again to be aware of. Face crop is my go-to, but there's this one called eye crop. These are all found on the second page. So on the 3D tab, there's these arrows here that brings up this whole second page, of which the chroma map was there. And so on this second page is this eye crop button. And so the way eye crop works is that it takes your 3D image and it crops it basically into a cube. So if you want to make your 3D image a cube, iCrop is for you. And so what it'll do is you're able to change the size of these boxes and the orientation of these boxes to highlight the structure that you want. So in this case, we're looking at the mitral valve. We cropped out all the stuff around it, and then we're able to use rotate Z to orient the image. Now we have our mitral valve, in this cube form that is oriented appropriately. This is a video showing how to adjust the boxes. So, when you hit iCrop, it produces these boxes here. You can use the trackball and the left click button to cycle between box sizes. It's changing the box size. Box rotate will change the rotation of the box. And then box position will move that left box. And so you can change that box size, position, and rotation to highlight the structure that you're interested in cropping. And then if you want to change and move around the right box, there's this button here when you use iCrop called MPR left. And when you press that button, it'll change to MPR right. And then you can adjust the orientation, the size, and the position of the right box. Although I don't routinely use this, one of the handy features of this cropping feature is that you can use this view knob. There's this view knob down here that will then change the view. So you saw on the previous image that blue dashed line was on the top here, looking at the mitral valve from the atrial view. This view bottom will look at it from the ventricular side. So you see a different perspective on your 3D image where we're now looking at the flail from the ventricular side. And then you can also change it to view left, for example, to quickly see the valve and the flail segment, kind of what it would look like in the long axis, where my cursor is looking at the anterior leaflet and then the posterior leaflet here. And so it has these ways to quickly change your orientation of your cropped image, which can be helpful. Plane crop is another neat cropping tool. Again, it's on the second page of the 3D tab. And the way plane crop works is that it creates this plane that you can then move around your whatever you want to crop away. So we're moving it around now. Let's say I want to crop away a little bit on face. Then I move it on face, and then I turn the plane adjust knob, and then it'll crop away some of the atrium. Let's say I want to crop away some of this side. Then I can turn that and crop away. Oh, I cropped away too much. Okay, now I can bring the plane adjust knob back, and I can bring it back. And so the handy thing of this plane crop is that it gives you a lot of control in terms of what you want to crop out in any plane that you want in 3D space. But as a result, there's more input that you need to put into. I find it's often not necessary, but it gives you good control. So if you wanted to have more control, maybe plane crop is for you. And so this is an example again of that raw image that we had. And let's say we wanted to get rid of what was in the atrium. So we kind of create the plane. So we're looking at it on fast. And then we turn the plane adjust knob now, and now we got down what was in the atrium. And let's say we want to crop what's on the side here. So we move the plane to the side, and then we hit plane adjust, and now we've cropped away a little bit on the lateral aspect of the valve. Let's say we want to get rid of the aorta. We can move the plane there, and then we can crop that away. And then you have this image here that's cleaner. And important to note that just by cropping it, you don't actually improve the frame rate, but it improves how the image looks and is presented. And so plane crop gives you a lot of control to do that. Quick view is on, again, this second page for cropping. This is another cropping tool. And so this is the raw 3D image. And if we want to crop away quickly, when you hit quick view, it brings up the 2D images as it was acquired from. You click on that, and so that's where my cursor is right now on this cross. And then you drag in the direction that you want to show the image. So in this case, we want to look at it from the left atrium. So you click here, and then you bring it down, and then this will crop away some of the atrium, and then you'll have to rotate or rotate Z to orient the mitral valve properly. It's quick in terms of cropping it, but again, I find it's a little bit, it doesn't give you a lot of control, so I don't really like it. And then there's this 3D crop. It's the last cropping tool we'll talk about. It's in the bottom bottom left corner here, and it generally starts as 3D cropping off. It's on the second page of this 3D tab. And so when you acquire a 3D pyramid, it creates these different planes on it. So there's red min-max, there's green min-max, and blue min-max. And these are oriented to how the pyramid is acquired, not how your image or your structure of interest is acquired. This is to how the pyramid is acquired. And then what you can do is you can rotate, you can use the plane adjust knob and rotate between these different planes to crop away your image. It's nice because it's quick. Like you can quickly go to the bottom of the valve or the top of the valve to crop the image away. But one of the problems with this is that, again, this is oriented to how your pyramid was acquired, not to how the structure of interest was acquired. So if I tried to use this mode to crop away some of this stuff in the atrium for this mitral valve, I actually can't change the orientation of these min-maxes because they're built to the pyramid. And so then when I try to crop away using this plane, because I think it would be the most helpful, I've now cropped away some of my mitral valves. So this is not an actual helpful mode at all. For me, I find face crop is the easiest one to use, and that's what I tend to stick to. But I wanted to review the different cropping modalities so you have a sense as to what's available. And if you do get lost or you're not sure where to go, there's this handy reset button here, and you can reset the cropping, the orientation to get back to home base and then start over. And just in the last couple of minutes, just showing zoom. So much like with 2D echo, when you change the zoom, it's not going to necessarily improve your resolution or your frame rate. All it's going to do is make the image bigger or smaller. So you can see when you zoom out, it makes the zoomed image smaller. When you zoom in, it makes the zoomed image bigger. Dual view is something that I find helpful. This will show the structure from the opposite side. So this is an example again of our flail mitral valve posterior segment. And so you see the atrial side on the left, and then you see the ventricular side. We actually see that flail segment coming up here on the right image there, again in the P2. And it's just kind of nice. It shows the valve from both sides, and you can apply color here and see where the color jets originate. I like the dual view. There's different ways to display your 3D images, and so that's under this layout tab over here. The default starts as this pyramid. And so that's what you're seeing here is just a single image pyramid. The one over here that has the 3 smaller triangles and then the one bigger triangle shows your 3D image. And then it shows the 2D images it was acquired from, plus this made up short axis image here. Again, I find this helpful for the interventional procedures, but I think for diagnostic 3D echo, I don't think it adds too much aside from showing the 2D images that the 3D image was acquired from. And then there's these ones here that have 3 smaller triangles that displays your image like this. And then this one has 4 equal size sectors showing the 3D images and the images it was acquired from. I don't use these routinely. There's this hide color button, which hides the color that we've talked about. So this is showing a color image, and then you can take that image and then hide the color to show the image without color, just to see the structure. And then wall filter is, I think, the last thing we'll talk about for today, and I find this very useful. So wall filter is found, just going back here, it's on the second page of the color tab. There's a knob here. And so what wall filter does is it filters out lower velocity signal. So the lower the wall filter, the more lower velocity signal you're going to see. The higher the wall filter, the less low velocity color that you're going to see. So the default is 3, and then when you turn it to 0, you see there's tons of color here. Not really helpful. When you turn it to 9, we got rid of a lot of color. All you really see is the high velocity things, and this might potentially be useful for seeing the origins of jets, but it will underestimate the extent of the jet because we're getting rid of the lower velocity signal that will occur after the jet has started to spread around the atrium. And so this is an example of showing different wall filters from 0 all the way to 9. And you can see as we increase the wall filter, that lower velocity signal, the blue and red, starts to go down. And then we get these kind of yellows and purples over here. And I find this wall filter 5 to be kind of a sweet spot for still showing the extent of the jet, while also showing the origin quite well and getting rid of some of that lower velocity signal. And the last thing I'm going to mention is this light source. So this is on the touchpad. When you go to the True View, you can actually move around this light source. So where I'm clicking on the screen is moving a light source here, and it's creating different shadows. So I'll show that again. And so, if we click over here, it's moving the light source to the right, then to the left, then up. And it creates these different shadows. And then you can also change the depth. There's this knob over here in the bottom right called a light depth knob. And so that will move the light source up or down theoretically. And it can create different shadows, which can help with the perception of 3D images. Again, I don't use this routinely, but just so you're aware that it's there. Okay, so I know that was a lot, but I'm hopeful this was a good start into the 3D world before we get into some different and higher level topics, I think, next week. And so I'll talk about, where should you start? What's actually useful for me? So I think practicing biplane imaging and valve mapping is very useful. The concept of, starting in a place where you know where you are and then explaining against that to then learn more about the pathology, I think is very useful. That applies for transthoracic and transesophageal. And so biplane is a great introduction to getting into the 3D world. When you are going to do 3D imaging, optimize your 2D image. I can't say that enough. And then make the box as big as it needs to be to capture the structure you're interested in, but no bigger than that. Because if you make it unnecessarily big, it's going to make your frame rate low, and that's going to worsen the quality of your 3D image. I think orienting the image, getting comfortable with the trackball, the Z knob, adjusting the gain to clear out some smoke, and then using the face crop are good places to start for learning about 3D imaging. You can experiment with multi-beam HVR, but I tend to just stick to the one beat, to be honest with you. And dual view and wall filter are features that I actually find helpful when I'm understanding pathology. Things like the color palettes, vision settings, true view, light source, frame rate plus, I don't find they're helpful, but I show them just so you have context as to what these do. And so for the next session, we're going to talk about the approach to imaging the mitral, tricuspid, aortic, ASDs, left atrial appendage. We're going to be going kind of rapid fire through these structures, including how to orient, how to acquire, and then we're going to talk about NPR. And so with that, I hope that I've rotated Z and we've got some happy smiling mitral valves.